The global health agenda has been moving for the last 10 years. And in the last 5 years, there has been a culmination in the universal health coverage. When Margaret Chan, the Director General of WHO, spoke in Geneva at the World Health Assembly, she made the point that universal health coverage is the ultimate expression of fairness. She was highly applauded for this statement. Developing countries have come to realize that in order to have universal health coverage, we have to involve our people in their communities, because life is about health, not about disease. In Kenya, we were very lucky in that in the year 2006, the Ministry of Health Sector Strategic Plan recognized the community health strategy as the strategy by which we could reach all our communities. And in this case, it has been implemented actively since 2008. And I'm happy to say that since this implementation, we are beginning to see the results of the community approach. We have got, for the last 5 years, there has been a disappearing process in the malaria and cholera epidemics because of the active involvement of communities in the promotion of their own health care.
This launch comes at a time when the evolution of health services is currently underway. These products will therefore definitely provide the guidance and references needed by the community health management teams as they take up their responsibility in the developed health systems. I am also informed that the community health strategy is currently undergoing review. This review is designed to make the strategy more responsive to the current health needs of the Kenyan people, while paying attention to the diverse social, economic, and cultural backgrounds of different communities across the country. I hope that the focus on empowering communities and households to take charge of their own health will be retained as the hallmark of the revised strategy. JICA, through our ongoing technical cooperation with Ministry of Health, will certainly contribute to the successful review of the strategy. Allow me to mention and recognize the valuable effort and support for community health strategy by Professor Miriam Were, the Goodwill Ambassador for Community Health in Kenya. Her unwavering support in advocacy for the strategy, as well as contribution to CHS policy development, is greatly appreciated.
I am very happy to be here. Community health is very near and dear to my heart. Kenya deserves strong praise for having placed such a high priority and strong commitment to this area. As we've been discussing this morning, we all know the importance of having an essential package of preventative and curative services available at the community level throughout the country. The community health workers who work tirelessly in communities, rural, urban, and semi-urban, are the backbone of this effort. The community health work units, which we see are being rolled out and created around the country, are actively engaging communities to take responsibility for identifying and working to address the priority health issues in their areas. As I was reflecting this morning, the entire community health strategy is perfectly designed to fit with constitutional reforms, devolution, and Vision 2030. Therefore, it is a very current and important effort.
As development partners, we feel privileged to be serving in this government and this country that is actually showing the way in this region through innovation and very strategic actions for the health of the people. And I dare affirm that any country that wishes to actually ensure economic development must start by ensuring the health of its people. So health for development. Some of you may recall the Alma-Ata Declaration endorsed in 1978 in what is now Kazakhstan. It spelled out at that moment that primary health care as the basis of effective delivery of health services. Ladies and gentlemen, at the heart of this declaration are five major principles of primary health care. 1, universal access to health care. 2, commitment to health equity. 3, community participation in defining and implementing agendas. 4, appropriate skills and technology. And we saw this morning how digitally focused this community health strategy is in Kenya. And finally, intersectoral approaches to health. When I think that the Alma-Ata Declaration was endorsed over 35 years ago, I'm gratified and reinforced that its principles still hold true today in the community health strategy. We believe that the communication strategy for community health services that is being launched today will go a long way in harmonizing messages and all communication-related aspects of the strategy. In addition, the implementation of the strategy will help to streamline advocacy for community health services in the context of devolution. In closing, as development partners, we recognize that the community health strategy does not lack challenges. However, it is a powerful tool for social transformation. Ordinary people are being given a chance to influence the way healthcare is delivered and thus gradually restoring their confidence in the health system. More importantly, the community health strategy is a life-saving intervention that is improving the chances of survival for women, men, and children.
Community health strategy is something that I learned of when I came to the health sector a few years ago. Not so few, talk about 5 years from 2008. And that is when I learned from the person who handed over to me, is now a member of parliament, Dr. Nyikal. He said, if there's one thing that we wanted to succeed here, and if there's something that you should pursue with vigor, it should be the success of community health strategy. So I really look back and say we have come a long way, that today we have had a digital presentation from very able professionals who have been working with our development partners over these years to produce what we can now see as community health documents that we can use to promote that which will empower the people of Kenya.
So what you are doing is providing a very critical supplementary support to the government of Kenya. And I'm very, very impressed that this debate actually even started long before the government could come up with its manifesto, which means you are miles ahead of the government and the politicians. And we really thank you for that. At a personal level, I feel that you are really partners of this country, and we shall do all we can to make sure that the partnership we have with yourselves is strengthened. The third thing I'd like to mention is that if you look at our Constitution, it does refer to exactly what you're discussing today. if you look at Article 43 of the Constitution, it talks about making sure that everyone has got a right, basic right to health care. And that will not happen unless we have this kind of very innovative, community-based health services. It will not happen. What you are doing, actually, you save lives. Because if you have these community workers, community officers, closer to the population and closer to the patient out there, what will happen is that cases which are normal, you'll be treated and cured. If you don't have this kind of initiative, what will happen is that normal cases, you become critical because there'll be nobody to attend to those patients. And I think if you manage to provide first aid through these community services workers or officers, it will avoid people being transported by ambulances from the rural areas into Nairobi or into the county hospitals. As a ministry, we highly appreciate your presence and the partnership that you have clearly been demonstrated. Today, we are gathered here to launch documents that the Ministry of Health has developed over the last 2 years in support of the community health strategy. These products consist of training and capacity building booklets, briefs, and reports. It is important at this juncture to acknowledge the role of development and stakeholders in sustaining the partnership that has led to this success. The partnership has proved that together we can achieve what the Constitution envisages for our people in terms of the right to health. Ladies and gentlemen, the Kenya Health Policy Framework 2012-2030 and the Kenya Health Sector Strategic and Investment Plan 2013-2017 recognize the community as a first level of formal health service delivery. This focus on community level preventive and promotive health activities goes to underline the fact that it is easier, cheaper, and more prudent to prevent ill health than to cure it. We are convinced that they will make a difference in the delivery of healthcare at the primary level. As I conclude, I wish to appreciate the technical financial support that has been extended to my ministry by various development partners, and they're all here, USAID, JICA, UNICEF, HENET, and all the others present. I look forward to the strengthening of our partnership. It has been a very worthy effort.